I am Rachel Leeret, and in this video, I will be talking about creatine and if it can effectively improve muscle mass and athletic performance. Creatine is an amino acid that is found naturally in muscle cells. It helps your muscles produce energy during heavy lifting or high-intensity training. It is one of your body's natural sources of energy for muscle contraction. Creatine increases the levels of phosphocreatine in muscles, which is used by creatine kinase to regenerate ATP. There are many reasons that people decide to use this supplement. The first one is that it has been shown to improve athletic performance and energy production by allowing athletes to complete more work, such as reps or sprints, that lead to greater gains in strength, muscle mass, and performance. Short, fast movements use a different energy system than aerobic exercise. It mainly uses creatine. So, in theory, the higher creatine stores you have, the more time you have until you fatigue. Additionally, creatine has been shown to reduce the frequency of injuries to muscles, bones, ligaments, and tendons. Creatine supplementation plus resistance training translate into a larger increase in bone mineral density, muscle strength, and a lean tissue mass than just resistance training alone. There are some negative side effects that are not 100% proven but have occurred in supplementation. The first one would be dehydration and muscle cramps. Creatine alters your body's stored water content, driving additional water into your muscle cells. However, this shift in cellular water content is minor, and no research supports the claims about dehydration. The next big side effect is kidney and liver damage. Creatine can slightly raise levels of creatinine in your blood. Creatinine is commonly measured to diagnose kidney or liver conditions. However, the fact that creatine raises creatine levels does not mean that it is harming your kidney or liver. And lastly, research has thoroughly documented that creatine supplements cause a quick increase in body weight. This weight gain is due to increased muscle growth, not increased body fat. In order to see results or achieve goals, it is important to consume the correct amount of daily dosage. For creatine, you want to start with the loading phase, which is the first 5 to 7 days of creatine supplementation, in order to supersaturate the muscles. During this phase, you would take 20 grams of creatine in divided doses 4 times a day for 2 to 7 days. This is followed by a maintenance phase, which is a dose of 2 to 5 grams daily for several weeks to months at a time. While researching, there are 3 case studies that help determine the effectiveness of creatine supplementation. The first study is measuring the difference between creatine pyruvate and creatine citrate during high-intensity training. 49 healthy male subjects performed intermittent hand grip exercises of maximal intensity. They were evaluated before and after 28 days of creatine pyruvate and creatine citrate placebo intake. The study protocol shows that the hand grip exercise was performed with the arm stretched in a horizontal position. The hand grip was connected to a basket that would be loaded with weights. The subjects were instructed to squeeze the hand grip as many times as possible during a 15-second exercise period. The weight starts at 7.5 kilograms and is increased by 2.5 kilograms every 3 minutes. The studies show that the body weight increased in both creatine groups. The circumference of the forearm increased in both creatine groups, and the concentration velocity increased 24% with creatine pyruvate and 20% with creatine citrate. Additionally, the creatine pyruvate showed significant improvements in force. Lastly, the creatine pyruvate intake significantly increases force and decreases fatigue. The second study shows the effects of creatine ethyl ester combined with heavy resistance training. It assessed how it affects muscle performance, body composition, and serum muscle creatine levels. Participants engaged in a 4-day per week resistance training program, split into 2 upper and 2 lower extremity workouts per week for a total of 7 weeks. Participants were orally ingesting capsules and powder which contained either placebo, creatine monohydrate, or creatine ethyl ester. The study protocol of this study consisted of 30 healthy men completing resistance training. There were leg press and bench press maximal strength tests where weight was gradually increased until a maximum strength was reached. Then anaerobic power was testing by starting with a warm-up of 30 RPM for 120 seconds, which was followed by a maximal sprint. Following tests, their body composition was measured during using the DEXA. The results for body composition show that there is a significant difference between groups for fat mass. The creatine monohydrate had significantly more fat mass than the creatine ethyl ester, and thigh muscle mass and fat mass significantly increased. When it comes to muscle strength, there was no significant difference between the groups, but there was a drastic change between each testing day. This graph shows the difference in serum creatine between each testing stage, and it represents higher serum creatine concentrations in the creatine monohydrate group when compared to the placebo and creatine ethyl ester. This slide represents the data taken for muscle creatine and how the total muscle creatine content was significantly higher in the creatine monohydrate and creatine ethyl ester groups when compared to the placebo. It also indicates significant differences over the course of the 4 testing sessions, where creatine monohydrate increased at day 6 and 27, and creatine ethyl ester increased at day 27. Lastly, another result shows serum creatinine levels and how serum creatinine was greater in the creatine ethyl ester group compared to the placebo and creatine monohydrate groups, and those changes were observed on days 6, 7, 27, and 4. And the last study I researched is the effects of creatine supplementation on muscle power, endurance, and sprint training. 19 trained male handball players were randomly assigned in a double blind and given creatine or a placebo group. Before and after supplementation, subjects performed 1 repetition maximum half squat and bench press followed by 1 set until exhaustion. Additionally, there was a counter movement jumping test and a repeated sprint running test. The results of this study showed that creatine supplementation significantly increased body mass, number of repetitions performed to fatigue, and total average power output values. Additionally, the average percentage of bench press and half squat increased drastically. Moreover, short-term creatine supplementation leads to significant improvements in lower body maximal strength, maximal repetitive upper and lower body high power exercise, and total repetitions performed to fatigue. Although creatine supplementation helped with high intensity sprint running, it does not result in any improvement in endurance running performance as well as upper body maximal strength. There were also no observed changes in the strength, running velocity, or body mass measures in the placebo group. So, can creatine effectively improve athletic performance and increase muscle mass? Yes, in my opinion, I believe that creatine is a highly effective supplement that is able to not only increase muscle mass and athletic performance, but enhance sprint performance, number of repetitions before fatigue, and overall muscle strength and performance. This can ultimately lead to an increase in athletic performance. Additionally, due to creatine's overall energy increase, it can also help people of older age to work out for longer and can decrease their chances of osteoporosis and other diseases that can be fatal in the future. Although the last study measured and found that creatine does not improve endurance running, there are many other positive effects of creatine that can outweigh the negatives. In conclusion, I believe that creatine is a very effective supplement for all different athletes or individuals that are looking to improve their workouts and their overall lifestyle.